Okay, good afternoon.
Good afternoon, ma'am.
Good afternoon, ma'am.
Okay, gutegi lagi hapon kita na ano. Pas kaya na aga, nag-rally at dagihap. Bumulig ang rally. Anyway, okay, let me share to you our class activity for next week. So, ikon ko nalada yun. Let's try with the canvas. So, for class activity, this will be your, wala ka mo yan na, tawag ito, wala ka mo assignment, or assessment, formative assessment. This for class activity. So, conduct a patient interview and assessment with cardiovascular cardiopulmonary dysfunction and document the following history, systems review, test and measure. So you may download the ebook Get and Back to guide you in writing history, systems review, and documenting test and measure, 4th edition. So it will be presented in our face-to-face class. So mas maupay ko may ka mo iyo balay, may niyo pasyente, mas marupay. Pero kung waray, okay lang, maghimo-himo lang ka mo. Okay lagi hapon, tama to mahihimo. Anyway, so this will be a group activity. So kanina ang gimbuhat, tawagin ni 4 groups lang. Kasi I want to focus more on the practice and aton test and measures. Kasi with this activity, may dapat kamusa. So that will be the test and measures. So test and measures, so these are the list of test and measures. Pero kamu tanan, let me check doon para ba kamu tanan dili. Kan dili upod. So wait. Sorry. So 21 as well, right? 21 gyap ka mo. So for 4 groups na lagap ka mo for class activity 1 and for class activity 2. Yang kuanay. So individual ang class activity. This 25, ihap nung kanina morning, so this 25 test and measures. So ang palpation, under palpation, may nakita tracheal shift, chest motion. So kung usay palpation, din niya kaya itong tanan. So gintatag usa-usa gipitera. So there are 6 under palpation. So ano yun? Ay, nag-circle ako. 3, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 15, 16, 17, 18, 19, 21, 22, 23, 24, 25 lang yan. So, bayan pag-iya po kanina, upod ko on palpation na word. So, that 24 lang ngayon harangatanan. So, ginkuha na lang namon ang Homan sign, kaya maram naman kumuka mo, Trendelenburg test, nganhin rubber of dependency niya. So ginkuha ko na la ito hiya nga Homan sign, so ang rubber dependency and Trendelenburg test. So sa pa kanina rate of perceive kasi kanina ginupod ko gihap, which is din na dapat na magkukulang liwat, rate of perceive exertion. So tulula nakin ko kay 24 lang ini niya. Okay, so individual, so bahala ka mo pag assign kung hinutay bida iton. Bahala ka mag-assign kung ano. Para basta maubos ito hera. So we'll start with, next week, we'll start with the patient interview. So documentation. So please download the ebook para ka mo may guide to document. And I have examples here and aton for our discussion yan ang adlaw. And then after start with that, then after yung patient history, patient interview, susundo na nato ang test and measure. So I advised you to bring your own stethoscope next week kasi we'll be practicing auscultation of the heart and lungs. So kailangan individual ito may da. So nadepende na lang iyo test and measure kung may din yung kinahanglan nga equipment. So kamot balas. Singon ta waist circumference or BMI, kalaman BMI tawag ini calculator, waist circumference, tape measure. So dito. So bahala ka mo kung hindi mat naka-assign ito kamulat pagdara. Okay, tapos I think that's all. It will be next week. Again, for class activity 1, the history taking, the patient interview, group activity, upat na lang kamo ka groups. So one group will be 6 students. So Ma'am Fabi will be with us next week para at least makaguide ha atong gihapon, makabuli. So let's start with, and the module for this week, it is additional niyong reference for the test and measure, an examination, content, history taking. Okay. So, pakibasa na lang din yung part gihapon. Tema lang eh. So, let's start with our discussion for this week. So, waray ka mo deadline, waray ka mo formative assessment for this week, only assignment for the class activity next week. So, examination, evaluation, and assessment. We start with systems review. So, a screening of all major systems. So, under your systems review, you will assess communication ability of your patient, the affect, cognition, language, and learning style. Okay, so you can actually assess this during history taking. So the way the patient speak, what language do you have preference, and you could ask learning style, which way your patient learns best, if it is by demonstration or by instruction lang, kaya niya, it's better to ask. So, para gihapon, kasi it's more of education kita ha, physical therapy. We're teaching patient not only the disease process, but as well as the treatment or the exercises. Okay, so under the systems review, we'll check the cardiovascular and pulmonary system. This is in general, a gross, okay, gross examination. So we're going to take the vital signs and presence of edema. For cardiopulmonary patients, needed and presence of edema. Okay, you have to check for edema kasi, we have conditions na nagkakaada yung edema na atong patients. And then musculoskeletal system, you have to examine the gross symmetry, gross range of motion, gross strength, height, and weight. So when you say gross, nakikita mo pala, hindi nga systems review, nakikita mo, okay? Nakikita mo ni mo patient. So, na-walk pala an imo patient towards you, nakikita mo if there's a gross symmetry, so bubutang ni mo impaired. So if ever there's impairment, pagka tumag-test and measure nga part, so this is after the history taking, no? So history taking, patient history, followed by systems review, then test and measure. So pagka tumag-test and measure nga part, pagkita ni mo there is impaired gross symmetry, then you may add a postural analysis. So, para dito sigurado na. Kasi baka nagyayakan, nakikita yan na, yayakan mo lang, may din asymmetry or may din weakness. So, pagka tumagdas and measure, mo tatagos sa So, another is neuromuscular system. Gross movement involving balance, gait, locomotion, transfer, and translations, as well as motor control and motor learning. Then integumentary system, included to an examination of the texture, the presence of scar formation, skin color, skin integrity, very important to us, diba? And commonly also in cardiopulmo, especially peripheral vascular diseases, may mga wound or mga ulcers. So kailangan makita natin ang integumentary system. So this is example of a systems review under objective. examination. Oh, so systems review, okay, kita niya ang cardiopulmonary, BP unimpaired kay 120/80. So pulse rate unimpaired kay 70 beats per minute. So under integumentary, impaired kasi may positive ulcer on the bilateral sole, nakita niya ang PT, which is left greater than right. Then there's a positive seropurulent exudate with bad odor, meaning may nagawas na iya ulcer. May nagawas nila nga, we call it exudate. Okay, positive yellow nade discoloration. So these are the gross. Pag kita mo pala, upon observation, nakikita mo animo patient may problem. So musculoskeletal system, gross symmetry, unimpaired, gross range of motion, unimpaired, strength, unimpaired. So once there is an impairment, nakita mo pa there's unimpaired, ayaw na ito paghimuhin, pag-abot nyo din, pag-updating test and measured range of motion test or MMT or MMT. Kaya waray naman. Kaya pag kita nimo, unimpaired man. So, ang maka-importante ito, systems review. So, kikita mo, pwede mo as a guide in hiya, kung at mo next step, nga specific nga, gagamiton nga, outcome measure, didiliwat hiton mo test and measures. So, neuromuscular system, gait impaired. So, once na kita niya, may dati paglalakat impairment, then, pagkat yung test and measure nga part, maghihimo hiya hing gait analysis or maghihimo ka sa PT hing gait analysis. Kung balance impaired, so magkakaroon kahing balance assessment. So that's important. So mga unimpaired na ito pag pinambutangi dito test and measure, di na kinanglan tagusaw sa umupa kasi animo gross examination, unimpaired man. Okay, the affect, communication, unimpaired, it is age appropriate. Affect, in terms of emotional and behavior responses, unimpaired. So nakikita man nimo, ma-assess nimo while you're talking to the patient or while interviewing the patient. Cognition as well, ma-assess mo niya. Learning barriers. So may niya learning barriers ng gimbutang ng PT kasi vision, uses of eyeglasses. Learning style, patient learns best by demonstration. Pwede gap education needs, you may add. Kasi in this this patient, may niya ulcer. So kailangan hiya diabetic foot care na education. So let's go to tests and measures. So these are the guide categories for tests and measures. You don't need to to address all of these tests and measures kundi rin man hiya upudan imo gross nga observation or didon systems review. Okay, so di rin hintat na depende ang patient, na depende. So this is an example test and measures. Di rin hiya in continuation hadto kaninang aton systems review. Okay, so this is another example. Okay, so another patient. So test and measures, tawag ini, ocular inspection. You check the patient endomorph ko niya, moderately kyphotic posture, decreased walking speed, and increased base of support. So, klaro na niya may gait problem. So, pwede ka magbutang mo test and measures, specific nga specific nga gait analysis didi nga outcome measure. So, pwede ka maghimon table of Pili-Orobos. And palpation, grade 2, vital signs, very specific didi hiya, pagbutang diin hiya, nagpuwahin blood pressure, din artery, auscultatory, sitting, anong yung position ng patient, and likewise, and respiratory rate, anong gingamit, more on diaphragmatic type, aniya, breathing, temperature, axilla, sitting position, dermatome, patient has impaired sensation, so kailangan niya specific as to what impairment, light touch ba, deep pressure ba, pinprick. Okay. Hematomes, kung may daman. Problem, cranial nerve testing, kung kinanlan ba mag-cranial nerve testing. Okay. Limb girth measurement, kung may edema. Muscle girth measurement, kung may atrophy ba. And chest expansion, kung normal. O kurugan pinagamit natong fin. Okay. So, let's go to the third step. So, after hand history taking, magkitahan systems review, then we call this under hitong gihapon hinihiyan test and measure. This is the third step, initial evaluation of the patient. So after mo history taking, systems review, then this is the third step, which is included niyan test and measure. So this specifically for cardiopulmonary conditions. Okay, and there are physical examination, inspection, so auscultation of the lungs, auscultation of the heart, palpation, immediate percussion, and activity evaluation. So pinakalas na activity evaluation. So under inspection, so you should perform in a systematic manner or systematic way, meaning from head downwards. Ito yung inspection. Yung kikita mo from anterior to posterior part. So posterior part, pagkatong posterior part, kita lang from head downwards. Side view from head downward kung kinahanglan. Okay, so inspection, general appearance. So wala hindi mo gilalabdan ni patient, wala din yung kakaptan, kakita ka lang, observe ka ni mo patient. So facial characteristics and effort to breathe, evaluation of the neck, evaluation of the chest, and your evaluation of the chest during resting and dynamic. Okay, phonation, cough production, appearance of extremities. So katagusaw-saw natin niya, hindi na kamuma, kapoy dida. Okay, general appearance, basically level of consciousness. So again, this can be assessed during history taking, di ba? Skin tone, check for skin tone if there is body history indicate or whether there is problem of oxygenation and perfusion, especially the mga extremities, fingers and toes, body type. So, ang nila ginagamit ng body type. Kita endomorph, mesomorph, okay na ito, ectomorph. Pwede na ito, no problem. So, inspection also, posture position. You may also document the posture of your patient or the position of your patient. So, as we all know, in this position, may dito problem in breathing. Pero liwat habitual lang. Diba? Kung nalingkod na liwat hiya, tapos nagulat tayo mo, mulat ya kakuha sa cellphone. Dito niya may problema hand breathing. Waray problema. Pero kung sugat ya position, tapos makurit ya pag-breathe, there's a increased work of breathing, there is increased use of accessory muscle. So, ito nga masaring ka, nagkakadahiyahin, shortness of breathing. So you can also check kung inpatient, inpatient, so patient. So gigitaw ni mo iya position. So in this case, may dahiya problem there could be a problem iya breathing kasi at least naman naka-elevate niya up. Niya ulo. Okay. And if the patient needs for external monitoring support equipment, some patients with cardiovascular problems, especially pulmonary problem, may niradarang oxygen. Okay, so, or the hospital may mga equipment na naka-attach sa patient. So, make sure you know those equipment and then whether the equipment is being used correctly by the patient. Okay, so, and sometimes may mga Holter monitoring ang dindadara ito yung patient, so dapat ma-check it niyo. Okay, so, in terms of equipments and attachment, later na kita ito tatagusaw sa liwat. Next nito natin ng mga topic. Kaya bangin liwat ikaw, matanga, diri ka maaram kung ano tiya. Yung patient pa ang nag-storya or nag-educate tayo mo. Anyway. Dyspnea versus SOB. So when are you going to use dyspnea and SOB during documentation? So dyspnea is a subjective report. So meaning it's more of a symptom. As SOB is actual symptom observed. So na-observe mo sign. So in terms of using this terminology, you may use dyspnea during history taking. So patients complain of dyspnea, diri complaints of SOB. Marami ito mo patient kung SOB. Okay. Dyspnea. Okay, and then the actual symptom of SOB, you can document or write or use this terminology during ito mo objective during objective documentation or during evaluation. Okay, ikaw as a PT magamit. So kung history taking, you could use these mga terms. I mean, can be interchanged and also they are the same. Okay, not the same in terms, both of them, there are difficulty of breathing, kumbaga, or shortness of breathing. Okay. So under inspection, we have the facial characteristics. You have to check any facial signs of distress, like nasal flaring, sweating, paleness, or unfocus or enlarged pupils. Ito nga namumudlat. Tapos focus yet yung breathing. An effort to breathe, when by facial expression of distress. So, ini na nga facial signs of distress, meaning nagpo-problema tiya pag ginhawa. Pukuring. So, that is a sign of there is increased work of breathing. And degree of work put forth from the musculature of face and neck. So, makikita mo gapit at effort to breathe if they use the accessory muscles. And the movement of lips to breathe, which they use pursed lip breathing. Pursed lip inhalation, nose, tapos ma-breathe out through pursed lip. Okay, evaluation of the neck. So, you may check any if there is an increased activity of accessory muscles. So, kita ako if there is hypertrophy of these muscles. So, one of the common hypertrophy is SCM, sternocleidomastoid. So, this one is hypertrophied ng sternocleidomastoid. So, this patient use accessory muscle. Diri hiya, kumbaga, when you say accessory muscle, bagat diri gud hiyaan iya function ito. Distended jugular vein. So this is a distended jugular vein. It may indicate the patient have right-sided heart failure. Kita na baro nakita ito. Then you may now evaluate the chest during resting and dynamic. So resting chest, symmetry. Di mo palalagtanin mo patient, you have to check for symmetry, configuration, rib angles. Actually, nga rib angles, makurin mo ma-observe. Observe mo la, di ba? Unless, in this inspection, by the way, your patient kung pwede maghubo. Okay, para ma-check mo hiya. So, dapat naka-closed nga room, especially if it is a female patient. And also, under resting chest, intercostal space. Kung may an intercostal space is halaghag or spacing. Kasi pag halaghag, it could be because of hyperinflated na iya chest. Or kung saktula. Okay, and also you have to, when you say symmetry, you have to check the right and left kung pareha si itsura. And also the muscles. Okay, if there's rigid chest, kung example is rigid chest wall, ang muscle ba na move kung may dapat din movement and upper part, mga accessory muscles. Okay. Now, dynamic chest is when you inspect or evaluate the chest during breathing. So you have to check, observe any breathing pattern. In rate, pwede ka na kumuha din in rate. Inspiratory-expiratory ratio, normal is 1:2, meaning pag nag-inspire ka, mas halabaan expiratory nga time. In which pag-inspire, mas haralipot compare expiratory. So that is a normal. So banging kita ni mo ba yung nagpaparehas lahan iya ratio. Pag ginhawa niya, so what nagpaparehas la. So dapat kasi in expiratory mahalaba pa. And symmetry of chest wall motion. So dili ka pa nalabutin yung patient, nakita ka in movement. While the patient's breathing, kung parehas pa, kung ading left, natubang ka matin patient, so nag-atubang ka ay left. So, ading left, mas na-inflate more compared to adi. Right? You have to check. Okay, anyway, this is the breathing patterns. Breathing patterns encountered in assessment of patients' respiratory problems. So, you may check this one. Nag-mention tanan iba hini, okay? Is under inspection. So you may document kung pagkita nimo, there's an apnea, you may document during the inspection part. And then respiratory rates, those are the normal rates. Then phonation. you may evaluate patient speech. So the assessment will be during history taking, mayakan pa natin yung patient. Phonation is, you may check if there is SOB or dyspnea of phonation. Okay, so may dyspnea of phonation, nag-ayakan yung patient, nag-utod-utod. Okay, maginhawa, tapos mayakan, tapos maginhawa na liwat. So nag-utod-utod, diretso. Okay, naka-diretso kita ko, normal nakadiretso kita, di ba? Kung nakulag ko yan, naginakan ako, nakadiretso ako. Pero may times ko ito na ginhawa ko, magguminhawa. Pero ito may danga ni SOB, it iya time. Ito, pag ginhawa, in between time nga pag ginhawa, pagyakan, baga di nakakaubos ito sa ka-sentence na ginhawa na. And voice control. So when you say voice control, because of SOB, mahina it iya voice. Hindi niya gusto mag-exert pa ng effort kasi nagkukuri niya pag ginhawa. Okay, cough. You may check for the strength, haniya coughing, the depth and length of cough, maiha ba, makuan ba, makusog ba, as a depth and halarom, okay, and production of sputum. So, ang luka is called sputum. Okay, so production, aniya quantity, color, smell, consistency. Kung if ever diri ka maka-encounter ng patient while you're assessing your patient, you may ask your patient, may nabay ni, siyempre naawod man ito pagpakita. Kung di man magpakita, you may ask, ano tsura, ano ito, damo ba, thick ba hiya, or just a watery lang consistency, and also breath odor. So, hamuto man lang ang patient. Okay. So, yan, di kita makaka-assess, good ka nagpakamas kita, no? Sino na lang, mabaho. Okay. So, guidelines for evaluating cough. So, these are the guidelines, cough characteristics. So, pagkita nimo if productive cough, this might be associated features for productive cough. So, it might be preceded by an earlier painful, non-productive cough associated with upper respiratory tract infection. So, pwede interpretation ito, lobar pneumonia. So, may nakita may example, purulent sputum. So, may pus, may yellowish and sputum. Sputum formerly mucoid, and acute could be acute exacerbation of chronic bronchitis. Diba mo itong common chronic bronchitis and purulent. So, you may check for this, what we call characteristics. And, di ba nagpakana, may nato papakanan hatong patient in terms of cough and depth and length and strength. So you may also find an outcome measure like this one, like Chester Cough Questionnaire. Pwede ka gumamit ini para madaliit mo kinabuhi as a PT pag-assess. Okay? So pwede ha, kung at least naman lasing ko pa magamit nga ni ko, at least maaram ka mo gumamit ng questionnaire. So questionnaires basically para la patient. So patient answer it. So diri ka ito answer. If they need assistance, pwede ka kahatag ka na ng question, mag-assist ka pa. Balit, if they need assistance, then pwede mag-assist ka. Pero actually, ginahatag. If they understand English, sige, pwede may tihatag nga questionnaire para madali. So, this one is 19 items. Okay. So, under inspection again, appearance of extremities. So, if there's a problem of circulation, oxygenation, nakita ni, you have to check the color, the skin integrity, texture, di ba? Kikita niyo if it is a, scaly? Oo, in here, scaly, okay. Ang tawag ito, most common, if there's cyanosis, digital clubbing. So, this Schramm-Ruth sign, if you suspect na there is a clubbing. Pero kung na mo natin tsurahin pag suspect, klaro na ito yan. So if there is, kung gusto mo lang for document purposes, you can use the Schramm-Ruth sign or positive. You may document positive Schramm-Ruth sign, meaning there is digital clubbing. So pasagot mo ni mo patient, then waray nga hiya, diri minin hiya may dapat hiya may da space. May space di debut nga, pero hindi nga part nagdudukot. If there is a or clog fingers, yan, di rin nagdudukot. Okay. Auscultation of the lungs. So let's go to the next. So after inspection, you auscultate ka ng the lungs. So this is to confirm finding, rule out other cardiopulmonary dysfunction. So it also assesses ventilation or movement of the air in and out of the lungs. Okay, it requires equipment, of course, that would be stethoscope, interaction to the patient, kailangan ito nimuhin, cooperation ito mo patient, ang proper positioning, usually sitting position is good. Kasi at least naman relax ito mo patient. But then there are certain circumstances or situation in patient talaga is bedridden. So din bubuhaton, auscultate mo ang anterior part, then ipa-sideline mo ang patient, then auscultate the posterior part. Okay. So you may assess the intensity, the pitch, and quality of breath sounds. So tingin babati ni lung sounds or breath sounds. Okay. So like I said before, it should be in a systematic way from right to left. Kung right ka, you compare to the left, or left to the right. When you count the directions from the head downwards, and anterior and posterior. Anterior naman, posterior. Pag balik tarot yung patient, ha? So kung mahimo yan ang anterior part, buhat tanan, then posterior later on. So these are the, how we call this, the tawagin ni mga areas to auscultate. Ay mo lang. So this will be, amo ito taksin saying na next week should be practiced. Practice, practice, practice. So from right, pwede ka to the left. Kasi yung comparing the two, to both sides. Then, so sugad kayo ito. Pwede ito nga, pwede gihapon, all right, all left. And kasi we have upper lobe, middle lobe, and lower lobe. So you have to assess that. Kung an upper lobe with the right, okay ba didi parehas ba left? Right side naman nga middle lobe, lingual alit didi, okay ba? Tapos ang didiliwat, okay, and so on and so forth. Pati halikod. So precaution lang auscultation is if your patient have poor balance. So again, if the patient poor balance, paigdaan na lahiya, supine position, then side lie. And yun, you have to prevent dizziness secondary to hyperventilation kasi nag-auscultate of the lungs, ini-require to him deep breathing. So you may ask your patient to take a deep breath and then it could be kung baga malaksit iya breathing, deep breathing, naga-hyperventilate. Makadugang kapahit iya SOB. So what you're gonna do is at least naman tagihin time in each deep breathing. So in between deep breathing, tagihin time, mag-relax and then deep breath. Okay, and draping must be appropriate, especially if you have female patient. So rin pa, kung itong kailangan expose lang, itong chest la, it exposed. So in auscultation of the lung, you have the lung sound. We define whether we distinguish if it is a normal or adventitious sounds. And we have the normal sounds, which is known as your vesicular, the bronchial, and the bronchovesicular. So ang pagkakaiba nila. So vesicular is a soft, low-pitch sounds during inspiration. And then there's a minimal sound liwat during expiration. The bronchial, which is tubular sounds, is a loud, high pitch, equal inspiration and expiration, which is there is pause in between. So meaning, tanabatin mo, inspiration and expiration, parehas la kalabaan time, okay? Ang time pagbati mo. And there is pause in between. Bronchovesicular, a soft version of bronchial, but there's a continuous between inspiration and expiration. So meaning, pag inspire niya, waray niya pause. Pagbati mo na inspire hiya, diya na pause, to diretso ya to expiration. And can be heard between scapulae posteriorly. Okay. So the adventitious sound, we have two categories, a continuous and discontinuous. So wheezes and crackles are the example of this. And we have also a pleural rub, kung may dahi a pleural inflammation, makaka-check kahining a pleural rub, lower lateral chest, both right and left. Okay, so depende lot kung right or left itong iya. tawag ini problem. So now in this figure, so the example of the, what do you call it? It's not an example. This is the areas where you can auscultate bronchovesicular breath sounds. This one. Okay, and it is best heard according to this description. It is best heard between scapula or scapulae posteriorly, so the likod. And the vesicular breath sounds can be anywhere. Ito nga pula-pula, can be anywhere. And then, what ay hibronchial? Hibronchial is more of a, din niya may trachea dapit. As siya description ng bronchial is loud, high pitch, kasi dakot aton tube from the trachea downward, diba? So, ginhibot nga mababati ang hibronchial. So, we will practice this. And then, ano lot in hiya nga ABC? Okay. This figure